Now that we have discussed the clotting process, the more complex mechanisms that initiate clotting in the first place will be described. These mechanisms are set into play by trauma to the vascular wall and adjacent tissues, trauma to the blood, and contact of the blood with damaged endothelial cells or with collagen, and other tissue elements outside the blood vessel. In each case, this leads to the formation of prothrombin activator, which then causes prothrombin conversion to thrombin, and all the subsequent clotting steps. Prothrombin activator is generally considered to be formed in two ways, although in reality the two ways interact constantly with each other. By the extrinsic pathway that begins with trauma to the vascular wall and surrounding tissues, and by the intrinsic pathway that begins in the blood. In both the extrinsic and the intrinsic pathways, a series of different plasma proteins called blood clotting factors plays a major role. Most of these proteins are inactive forms of proteolytic enzymes. When converted to the active forms, their enzymatic actions cause the successive cascading reactions of the clotting process. Most of the clotting factors are designated by Roman numerals to indicate the activated form of the factor. A small letter A is added after the Roman numeral, such as factor 8A and factor 7A, to indicate the activated state of factor 8 and factor 7. First, we will discuss the extrinsic pathway for initiating clotting in detail. The extrinsic pathway for initiating the formation of prothrombin activator begins with a traumatized vascular wall or traumatized extravascular tissues that come in contact with the blood. This condition leads to the three steps. First is release of tissue factor. Traumatized tissue releases a complex of several factors called tissue factor or tissue thromboplastin. This factor is composed especially of phospholipids from the membranes of the tissue plus a lipoprotein complex that functions mainly as a proteolytic enzyme. Second step is the activation of factor 10 through the role of factor 7 and tissue factor. The lipoprotein complex of tissue factor further complexes with blood coagulation factor 7 and, in the presence of calcium ions, acts enzymatically on factor 10 to form activated factor 10. And third step is effect of activated factor 10 to form prothrombin activator and the role of factor 5. The activated factor 10 combines immediately with tissue phospholipids that are part of tissue factors or with additional phospholipids released from platelets, as well as with factor 5 to form the complex called prothrombin activator. Within a few seconds, in the presence of calcium, prothrombin is split to form thrombin, and the clotting process proceeds as already explained. At first, the factor 5 in the prothrombin activator complex is inactive. But once clotting begins, and thrombin begins to form, the proteolytic action of thrombin activates factor 5. This activation then becomes an additional strong accelerator of prothrombin activation. Thus, in the final prothrombin activator complex, activated factor 10 is the actual protease that causes splitting of prothrombin to form thrombin. Activated factor 5 greatly accelerates this protease activity, and platelet phospholipids act as a vehicle that further accelerates the process. Note especially the positive feedback effect of thrombin acting through factor 5 to accelerate the entire process once it begins. Now, let's discuss the intrinsic pathway for initiating clotting, the second mechanism for initiating formation of prothrombin activator, and therefore for initiating clotting. Begins with trauma to the blood or exposure of the blood to collagen from a traumatized blood vessel wall. Then the process continues through the series of cascading reactions. In first step, blood trauma causes activation of factor 12 and release of platelet phospholipids. Trauma to the blood or exposure of the blood to vascular wall collagen alters two important clotting factors in the blood, factor 12 and the platelets. When factor 12 is disturbed, such as by coming into contact with collagen or with a wettable surface, such as glass, it takes on a new molecular configuration that converts it into a proteolytic enzyme called activated factor 12. Simultaneously, the blood trauma also damages the platelets because of adherence to collagen, or to a wet table surface, or by damage in other ways. This releases platelet phospholipids that contain the lipoprotein, called platelet factor 3, which also plays a role in subsequent clotting reactions. In second step, there is activation of factor 11. The activated factor 12 also acts enzymatically on factor 11 to activate this factor, which is the second step in the intrinsic pathway. This reaction also requires high molecular weight kininogen and is accelerated by prekallikrein. In third step, there is activation of factor 9 by activated factor 11. The activated factor 11 then acts enzymatically on factor 9 to activate this factor as well. In fourth step, there is activation of factor 10 and role of factor 8. The activated factor 9 acting in concert with activated factor 8 and the platelet phospholipids, and factor 3 from the traumatized platelets activates factor 10. It is clear that when either factor 8 or platelets are in short supply, this step is deficient. Factor 8 is the factor that is missing in a person who has classic hemophilia. So, it is called anti-hemophilic factor. Platelets are the clotting factor that is lacking in the bleeding disease called thrombocytopenia. In fifth step, there is action of activated factor 10 to form prothrombin activator and role of factor 5. This step in the intrinsic pathway is the same as the last step in the extrinsic pathway. That is, activated factor 10 combines with factor 5 and platelet or tissue phospholipids to form the complex called prothrombin activator. The prothrombin activator, in turn, initiates the cleavage of prothrombin to form thrombin within seconds, thereby setting into motion the final clotting process as described earlier. Now, let's discuss the interaction between extrinsic and intrinsic pathways. Summary of blood clotting initiation. It is clear from the schemas of the intrinsic and extrinsic systems that after blood vessels rupture, clotting occurs by both pathways simultaneously. Tissue factor initiates the extrinsic pathway, whereas contact of factor 12 and platelets with collagen in the vascular wall initiates the intrinsic pathway. An especially important difference between the extrinsic and intrinsic pathways is that the extrinsic pathway can be explosive once initiated. Its speed of completion to the final clot is limited only by the amount of tissue factor released from the traumatized tissues and by the quantities of factors 10, 7, and 5 in the blood. With severe tissue trauma, clotting can occur in as little as 15 seconds. The intrinsic pathway is much slower to proceed, usually requiring 1 to 6 minutes to cause clotting. Now, let's discuss the role of calcium ions in the intrinsic and extrinsic pathways, except for the first two steps in the intrinsic pathway. Calcium ions are required for promotion or acceleration of all the blood clotting reactions. Therefore, in the absence of calcium ions, blood clotting by either pathway does not occur. In the living body, the calcium ion concentration seldom falls low enough to affect blood clotting kinetics significantly. However, when blood is removed from someone, it can be prevented from clotting by reducing the calcium ion concentration below the threshold level. For clotting by deionizing the calcium by causing it to react with substances such as cetration, or by precipitating the calcium with substances such as oxalate ion. This was all about this section. In our next section, we will talk about the intravascular anticoagulants.
Explore our extensive library of over 1,800 video lectures to learn about a wide range of topics. Only on sqadia.com.